Hi, my name is Courtney, and I'm going to be going over the Pakistani culture. For their religion, Pavri states that many Pakistani Americans are devout Muslims, and the Holy Quran and the teachings of the Holy Prophet serve as their guiding principles. There are two major Islamic sects, Sunni and Shia. Sunni follow the customs of Muhammad, and they also believe that the leader should be someone they all agree to succeed. While Shia, they follow the customs of Ali, who is a relative of Muhammad, and they believe that the leadership should stay within the family. For communications, there's actually many languages spoken throughout Pakistan, but Urdu is the official language, and English is widely taught in the schools. There are many nonverbal styles of communication, such as avoiding direct eye contact, as direct eye contact is considered rude. Their hands mean different things. The left hand is usually used for like cleaning and is considered dirty, while the right hand is considered clean, and they use it to eat, touch other people, like as in a handshake. Offering items is done with the right hand or with both hands together, offering it. And when they gesture, it's with the right hand, and it's usually the whole hand and not a finger, because fingers are pointing are considered rude. Basil states that male doctors may have to communicate through a spouse if the patient is female. So basically, if there's no response from the client, it's best to ask if they would like their spouse to be the one that they speak to. For customs and greetings, Avason states the most common greeting among Pakistanis is Assalamu alaikum, meaning peace be upon you. There are slight variations, but they all generally mean the same. Pakistanis respect and value their elders. They are served and given first choice of food and drink. Their wisdom is highly valued, and they are usually the ones to make important decisions regarding the family. This can mean medical decisions, marriages, and even naming babies. Women should be dressed modestly in loose-fitting clothing that covers everything from the face and the hands. Depending on how conservative they are, they may actually be covered from head to toe. And men are generally covered navel to knees or below. If possible, when providing care, you should have someone of the same gender provide the care. If it's not possible, then there should be a third party, and that person should be of the same gender as the client. The only exception is emergencies, where at that point they value the life over their beliefs. For nutrition, a halal diet should be provided for Pakistani patients. While dietary habits and preferences can differ, most Pakistanis abstain from eating pork byproducts, shellfish, non-halal animals, and alcohol. But it's always best to ask. Food and drinks that are commonly consumed are rice, breads, legumes, vegetables. Meat dishes such as lamb, goat, chicken, and beef, though they should be halal. And in order to be considered halal, they are raised and slaughtered according to Islamic laws as defined in the Quran. Pork is actually forbidden in the Quran. That's why they refrain from eating it. For health problems, they have many genetic and acquired diseases that they're at an increased risk for. Hypertension, coronary artery disease, certain cancers such as breast and lung cancer are very high, and they are also at an increased risk for diabetes. Pregnant women are at a higher risk for dyslipidemia and obesity. There's also a lot of cousin marriages in Pakistan, so there's a high risk for genetic abnormalities with babies. For the socio-environmental diseases that they are at an increased risk for are hepatitis A, B, C, and E, typhoid fever, Japanese encephalitis, malaria, rabies, tuberculosis, and Zika. And in Asia, Pakistan is actually one of the places that has like the highest rate of HIV. And most of the socio-environmental diseases can be prevented with vaccinations, but a lot of areas do not have access to healthcare providers or facilities, and that's why they actually have a lot more cases. On Lippincott, it states that Pakistanis may have the fatalistic view that illness is the will of Allah, and that following religious teachings and avoiding evil are essential to maintaining health. Illnesses can have a hot or cold quality and be treated with certain diets and treatments, such as herbal or traditional medications. And they also believe that a holy pilgrimage to shrines can help with healing. Mental illness is very stigmatized, and they are less likely to seek help for it, and many families will deal with it within the family. There are multiple different religious and spiritual practices, but one of the main ones is Ramadan, and they fast from sunrise to sunset for 28 to 30 days, and this can include medication. Even though the elderly and sick are exempt, they may still participate against medical advice, but they do have a pre-dawn meal as well as a fast-breaking meal, and so they're, if able, you can try to work your care plan around that. For kinship and social networks, Pakistani families are usually very close and patriarchal. They have traditional gender roles. Men usually go to work and provide and support the families, while the women take care of the domestic chores, raising the children, cooking, cleaning, and then they generally focus on the whole family, including the extended families, instead of individual members. And so this can have an impact on patient care. For end of life, illness and death are viewed as God's will, and comfort measures and pain relief are accepted. The discussion of death should be avoided, as they believe it may hasten death. Death is considered God's plan, and they may not wish to discuss advanced directives. Upon death, the deceased should be cleansed by someone of the same gender, and this is usually a relative. If that's not an option, whoever does clean the body should wear gloves. And then within 72 hours, there's a prayer for the deceased, usually led by an imam. And the deceased is usually wrapped within a piece of black cloth and tied at the hands and feet.